to Your Health, where we explore the latest in health across the country. I'm Erica Cardenas. During Breast Cancer Awareness Month, we want to highlight the importance of screenings and the information you should know about this disease that is diagnosed almost every 2 minutes in the U.S. But before we get into the details, let's take a look at what's coming up on the show. The difference rehab can make for those with pulmonary disease, and ways to avoid Medicare scams for seniors. Plus, innovative treatments for those battling addiction. All that and more coming up on Your Health. 1 in 8 women will be diagnosed with breast cancer in her lifetime. Being educated and catching it early will increase your odds for a good outcome. Here's what you need to know. There are currently more than 3.8 million breast cancer survivors in the U.S. When breast cancer is caught in its earliest and localized stages, the 5-year relative survival rate is 99%. The key to good outcomes is early detection. This includes doing monthly breast self-exams, getting regular clinical breast exams, and a yearly mammogram. Screenings can often show a breast lump before it can be felt. And cost shouldn't be a barrier to getting a mammogram. Many organizations provide free mammograms, so do an online search in your area to find an organization providing them. Also, knowing if you have dense breast tissue can help you determine if you should have further imaging. When getting a mammogram, they are required by law to inform you if you have dense breasts. If they don't tell you, ask. The signs and symptoms of breast cancer should also be front of mind when you're doing your monthly self-exams. Some possible symptoms are a change in the look or feel of your breast. This could include a lump or change in the skin texture, dimpling, swelling, or shrinkage. Visit the National Breast Cancer Foundation's website for a more detailed list of the symptoms. Women aren't the only ones impacted by breast cancer. Close to 3,000 men are diagnosed with breast cancer each year. So make sure the men in your life are periodically doing a breast self-exam. Men have a higher mortality rate since there is less awareness, which can cause a delay in treatment. According to the American Cancer Society, race and ethnicity does contribute to variations in breast cancer. Black women have the highest death rate from breast cancer, and Indigenous and Alaska Native women have the lowest rates of developing breast cancer. On the positive side, breast cancer death rates have decreased steadily since 1989 through 2020. The decrease is believed to be the result of early detection, increased awareness, and better treatments. So during Breast Cancer Awareness Month, make a commitment to yourself and schedule your screening. Pulmonary disease can cause severe issues with a patient's overall health, but with pulmonary rehab, these patients can be helped immensely. The experts at La Mesa Rehab show us how.
When I see a new patient who I suspect has chronic obstructive pulmonary disease or COPD, one of the first thoughts I have is that they need to go to pulmonary rehabilitation. It's the cornerstone of effective therapy for patients with COPD because it prevents worsening exercise intolerance, prevents hospitalizations and exacerbations, and trains patients how to deal with their own disease process so they can manage their medications and their therapies more effectively.
Pulmonary rehab can be a wonderful extension of the medical services to patients with COPD, including weekly reports to the physician about the patient's progress. On top of the pharmaceutical intervention and medications that we provide, the most important part of the treatment is referring these patients to pulmonary rehab. Any physician can initiate that process and refer the patient to pulmonary rehab, as we know that will help sometimes even more than pharmaceutical intervention.
When the patient gets admitted for COPD exacerbation and recover from that hospitalization, it is important to break that cycle. First thing for a physician is to make sure they're on the appropriate medications. Another important intervention is to recognize these patients and refer them to pulmonary rehabilitation program. My experience with patients who receive pulmonary rehab is quite positive. When I refer these patients, they come back to me saying that they have improved symptoms, they have improved functional capacities, a lot higher level of endurance. They feel great about it. Their attitude towards life is a lot better.
Psychologically and physically has been amazing improvement among all my patients, and I see it every day, and I highly recommend that.
When a patient's on oxygen therapy, you have to remember that oxygen is a drug with a dose that needs to be adjusted depending on the patient's circumstances and disease progression. The dose can be adjusted in the doctor's office, but can also be effectively monitored in a pulmonary rehabilitation setting where the patients are exercising and can be checked frequently and see if their dose has to be increased or decreased. One of the community resources that has been very effective over the years is the Better Breathers Club that's sponsored by the American Lung Association. It's currently being hosted by La Mesa Rehab in their facility, and it can be a very pleasant experience for patients to socialize and become educated about their disease process. If a patient has been diagnosed with COPD and is still having shortness of breath, they need to speak to their doctor about having their medications adjusted and to be referred for pulmonary rehabilitation, which will improve their exercise capacity and improve their quality of life.
One myth about breast cancer is that only middle-aged or older women are affected. But the truth is, while most cases do occur in older age groups, a diagnosis can happen at any age. According to the CDC, almost 9% of new breast cancer cases in the U.S. are in women under the ages of 45. Stick around, there's more to come on Your Health. How to avoid Medicare scams and getting the desired look you want with the help of La Hoya Cosmetic. Hoya Cosmetic prides itself as a place where dreams become real, and they can help create the look you desire. Let's see how they achieve this.
See, I was born in Poland originally, came to the United States when I was 11, and trained most of my life in Chicago. My undergrad was actually in visual arts, and I think medicine kind of became near and dear to my heart, but always wanted to find a way to combine medicine with art. And I think where I am today kind of marries those fields very well. I finished a general surgery residency back in Chicago, and then I went on to train in plastic surgery at University of Utah, and after that I did 1 year aesthetic plastic surgery fellowship in Beverly Hills. Part of my time in training actually happened in San Diego, and ever since we left San Diego, every single place that we lived in outside of San Diego never compared. So one of our incentives was to really come back to San Diego. Well, between the 3 kids, I think that keeps us pretty busy, especially the 15-year-old now that he is growing up and getting a driver's license. One of my personal passions is cars and driving, and he is definitely on board with that as well. So I'm proud to say I taught him how to drive a stick shift before he ever got a driver's license. He will get his license on a stick shift, and we kind of share that passion, so that makes it easy. So the Brazilian butt lift is a very popular procedure around the world, and it basically involves shifting fat around in any given person. So we liposuction a problem area that a patient has, and we take the fat and we transfer it over to an area that they want to curve out a little bit more. One of the trends I noticed when I was working in Beverly Hills is that I want a BBL, but I don't want a big butt. So what we did as a community of plastic surgeons, we sort of trended towards this new concept of a skinny BBL, which applies to any given patient that is actually very well fit, but there are certain problem areas on their body that they just cannot control in the gym. So we definitely have technology to try to visualize what the result may look like. One of the technologies that we use is Vectra. We have that in the office, and what that does is it takes a scan of the patient's entire body in 3 dimensions. Digitally we can shave away the fat areas and potentially augment the flatter areas. And it's really a tool of communication for me and the patient, and gets us on the same page, and I think the results are better because of that. I think people like my results because I really take the time. I think my procedures do take a little bit longer, but I get to be a lot more precise. I get to use smaller cannulas. I get to use all these techniques that I think are very important in order to give them not just that immediate result, but that lifelong result in a smooth contour. I think that takes time, it takes precision, but it's worth it. So I was happy to find out that my satisfaction rate for this procedure was 98%, or 4.9 stars, I think I saw somewhere. And I think it comes from the fact that I really do take the time and be very precise about the procedure, and again focus on that long-term result as opposed to just the immediate result for the patients.
Medicare fraud is rampant in the U.S., and Senior Medicare Patrol is educating the community about how these scams can impact lives.
Senior Medicare Patrol, or SMP, is a federally funded program of the Administration for Community Living. SMP's mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. We empower all through outreach, counseling, and education. We are a free resource to you, and every state has an SMP program. In Louisiana, Mississippi, and Georgia, the Senior Medicare Patrol program is sponsored by AdviseWell, Inc. Medicare fraud is a big problem in the United States. The federal government estimates it loses anywhere from $60 to $100 billion every year to fraud, waste, and abuse. Therefore, it's important that we reach the Medicare beneficiaries, their families, and caretakers so they know they can reach out to SMP if they ever think they've been a victim of Medicare fraud or healthcare scams. There are several ways we reach seniors. For example, we go out and give in-person presentations to groups, exhibit at events, and work one-on-one with Medicare beneficiaries. We provide educational opportunities for beneficiaries at places like senior centers and independent living facilities. We are also available to speak to church groups, social groups, and other organizations. Our presentations typically last 15 to 20 minutes, and we allow some time afterwards for questions and answers. We provide educational materials and giveaways to the attendees. We also schedule virtual presentations for groups if they prefer. When Medicare beneficiaries, caregivers, and family members bring their complaints or questions to us at SMP, we make a determination about whether or not fraud, errors, or abuse are suspected. When fraud or abuse is suspected, we make referrals to the appropriate state and federal agencies for further investigation. As you can see, SMP's mission is very important, but we are a small program, so we rely heavily on volunteers to help us educate beneficiaries in all 3 states. Therefore, our volunteers receive training to give presentations on Medicare fraud and scams, attend community events to help spread awareness of the SMP program, and participate in monthly webinars. In summary, Medicare fraud can wreak havoc on you personally and to the Medicare program. That is why it is very important to remember that Senior Medicare Patrol is here to help you. We are a free resource to you. Our toll-free number is 1-877-272-8720. You can also visit stopmedicarefraud.org to get more information and browse through our videos and podcasts. For volunteer opportunities, you can also call 1-877-272-8720 or visit our website. By working together in Louisiana, Mississippi, and Georgia, we can help our Medicare beneficiaries empower themselves. Stop Medicare fraud today by working together with SMP.
Being physically active is important for your overall health and your breast cancer risk. Research shows that regular exercise can lower a woman's risk for breast cancer by 10 to 20% compared to those who are not active. But before you lace up those sneakers, let's take a look at what's coming up on the show. A new podcast focused on empowering better healthcare and how innovative treatments are helping those with addiction.
From fitness to medical technology, explore how people are leading healthier lives on Your Health. Join Erica Cardenas as she introduces you to health experts, examines popular fitness trends, and explores new treatments for common conditions. Discover how the choices we make in our daily lives directly affect our well-being. Plus, learn simple tips for leading a healthier life. Watch Your Health Sunday, Monday, Thursday, and Saturday only on YourView, or stream it online at yourview.com.
Springfield Wellness Center is helping those with addiction and stress-related illnesses with their innovative treatments.
Springfield Wellness Center is absolutely exploding with new, exciting, helpful treatments. And I'm so happy to be a part of this. My name is Paula Norris-Metier, and I'm the founder of Springfield Wellness Center. I don't mean to sound like I'm bragging about Springfield Wellness Center, but I am so proud of all the things that are now available here. We have a wonderful, wonderful environment. It's peaceful, it's serene, and it is therapeutic. Just the environment alone We get feedback from all the patients who come in that just being in this environment is very, very helpful. Because we're mental health professionals, we started off giving IV NAD treatment to detox people from substances that they had become dependent on. And we've been doing that for a long, long time. And then from there, we developed a teaching arm of our practice so that we're teaching other people how to do what we do. And then we also have a research arm, and we are researching as much as we can about NAD so that we can learn more as we move along. So we've got the clinical aspects, we've got the training aspects, and we have the research going. But out of that experience, we also learned that it would help with post-traumatic stress, TBIs, it helps with Parkinson's, it helps with Alzheimer's, it helps with different types of dementia, it helps with so many things that most people in our country are suffering from. We are on fire with all of the new things that we can do. And we've discovered that there's a synergy between NAD and photobiomodulation, which is using red light therapy that is helping a lot of people, whether they are hurting from joint pain or they're hurting from inflammation in the brain. It is absolutely astounding what is going on. We have auricular therapy, we have hyperbaric oxygen therapy, we have beautiful pool and hot tub, we have the shake plate. All of these things that we're involved with now help the immune system, decrease the inflammation, and inflammation is the culprit. Inflammation is where the pain comes from, and we can reduce that, and in a lot of cases eliminate it. And you don't have to necessarily have something that is diseased state to come and see us. And so what I'd like to do is just simply invite you. Just know that you're welcome at any time. Just come by and see us. There's no commitment. You don't have to make a commitment. You can just come by and see if it fits for you. If you just want to be well, and if you just want to age gracefully, if you just want to be the best you can be, NAD will help you. And we can help you here at Springfield Wellness Center. So just come by. We'll be waiting for you.
Research shows that a nutritious, low-fat diet with plenty of fruits and greens can help reduce the risk of developing breast cancer. On the other spectrum, a high-fat diet can increase the risk because fat triggers estrogen production, which can fuel tumor growth. So ditch the fries and add a salad to your next meal. Here's what's coming up on the show. A new program empowering you to be a health advocate.
From fitness to medical technology, explore how people are leading healthier lives on Your Health. Join Erica Cardenas as she introduces you to health experts, examines popular fitness trends, and explores new treatments for common conditions. Discover how the choices we make in our daily lives directly affect our well-being. Plus, learn simple tips for leading a healthier life. Watch Your Health Sunday, Monday, Thursday, and Saturday only on YourView, or stream it online at yourview.com.
Educating the public about their health and well-being is the focus of a new TV show and podcast airing here on YourView and Spotify. Let's take a look.
In a world filled with busy schedules and endless distractions, taking charge of your health has never been more crucial. Welcome to a journey of empowerment, education, and well-being with Health Check with Dr. Noristani.
Hi, I'm Dr. Ahmad Noristani. I'm excited to invite you to join us on a quest for better health and understanding. You see, your health is your most valuable asset. It's time that we all take the reins and become well informed about our health and well-being.
We've all been there. Doctors' offices bustling with activity, and time is often short. But here's the truth. Staying informed about your health is not just important, it's essential. Doctors may not always have the luxury to dive into every detail during appointments, and that's where Health Check comes in. Our show is your go-to resource for in-depth insights on important health topics. Whether you're curious about the latest medical breakthroughs, seeking advice on managing chronic conditions, or simply looking to lead a healthier lifestyle, Health Check has got you covered. Health Check with Dr. Noristani isn't just another show, it's an opportunity for you to take control of your health journey. Being informed means you can make decisions that align with your well-being and make the most out of your visits to the doctor's office. But Health Check is more than just a show, it's a movement driven by people like you who believe that knowledge is power and that by working together, we can create a healthier, happier community. Dr. Noristani isn't just a doctor with over 16 years of experience. He's passionate, he's an advocate for change. He's not only started 2 nonprofit organizations to help the uninsured, but also actively engages in the community to ensure that everyone has access to vital healthcare information.
So are you ready to take charge of your health? Join us on Health Check with Dr. Noristani as we explore a world of possibilities. Learn from experts and hear stories that will inspire us all.
Tune in to Health Check with Dr. Noristani weekly to gain insights that can transform your health journey. Let's build a healthier, happier community together. Get ready to be informed, inspired, and tune in with your health. See you on the next episode of Health Check with Dr. Noristani.
Thank you for joining us on Your Health. Remember to schedule your annual mammogram. I'm your host, Erica Cardenas. Have a happy and healthy day. See you next time.